Yo, it's Mr. Eric, Friday, November 12th, 2021. If you're interested in nursing at all, so you're a nurse, you're thinking about going to nursing school, you're thinking about switching professions to nursing, feel free to tune into this video because I'm talking about Nursing Skills Day at the hospital. What is Nursing Skills Day? Well, it's the part of orientation where you get a refresher on your nursing skills that you learned in nursing school. Now, thankfully for me, a lot of these skills I've already done on the job at my previous workplace at Middlesex Hospital, so it was all pretty easy for me to understand. However, it's always good to get that refresher because you want to be on top of your game, especially when you take a break from nursing like I did. Okay, so the first skill I learned today, or got refreshed on, was how to start an IV pump. Super easy. All you got to do is prime the tubing with the fluid, which means you want to get the fluid from the bag into the tubing with no bubbles, because an air bubble going into somebody's vein can cause an embolism, make their heart stop, make their heart clog, and then lead to potential death. You don't want that to happen to somebody ever, especially on your watch. Okay, the next thing I learned was how to insert an IV catheter. An IV catheter is the needle that goes into your vein so that you can get fluid medications administered into your bloodstream quickly. The benefit to an IV instead of an oral medication is that the onset of effect is much quicker. Think about it. If you take a pill, it's got to go through your digestive system, then into your bloodstream. However, if you get an IV medication, it's in your bloodstream right away, going to have effects right away just like that. So that's why everybody in the hospital gets an IV given in the emergency department, because anything could happen in the hospital. So you just want to be ready if they need life-saving medication. That's why the last thing you take out of a patient before they leave the hospital is the IV. As long as the patient's in the hospital, the IV needs to be there, because they could croak right as they're leaving the hospital, and that's not going to be good. Okay, so basically what you do in IV catheter administration is you point the bevel of the needle up, you stick it into the vein, make sure you get blood return, you retract the needle, make sure the catheter stays in, and then you keep it in place with some transparent tape, gauze, whatever you got to do to keep it in place. The worst thing that can happen is a patient pulls the IV out, you got to do it again, because that means you have to stick them again, waste your time, and then they're going to get all these bruises. That's no fun for anybody. Do you want to be bruised? I don't think so. Okay, another skill we did, one of my favorites because I'm pretty good at it, is Foley catheter insertion. A Foley catheter is the tube that gets inserted up somebody's urethra because they have problems peeing in the hospital, they need strict INOs, or they have like a peritoneal ulcer that needs to heal, because if there's a peritoneal ulcer there, they can get infection more easily when they pee, or they get poop on it, or whatever. You never want urine or feces inside an ulcer. That's going to lead to horrible infection, so you just put a tube up their urethra to keep the urine away from it going into the bag. The number one thing to know with Foley catheter insertion is you got to be sterile. That means you have your sterile gloves on, you don't want to touch anything that's dirty, and then get the Foley catheter up in them, because that can lead to infection, because you get all this other bacteria on your hands that's going straight into their bladder. Another cool skill we did was central line dressing changes. A central line is a catheter that goes directly into the heart and can pull blood from it, and you can administer medications, TPN, fluid, right into the bloodstream that's in the heart. It is super easy to draw blood from, especially for labs, because the blood's coming straight from a secure location going into the heart. So it's pretty easy. You basically want to flush and then withdraw, waste, and then get the new draw, and so forth. It's pretty cool. When you change the dressing, you want to make sure you stay sterile around the area, because it's basically an open wound that's right there where the central line insertion site is. You want to keep that clean, because that can lead to infection too. If you think about nursing, it's all about infection prevention, really. That's why you got to wash your hands before you go in the room. That's why you got to keep your hands sterile during sterile procedures, and so forth. Okay, next skill, and probably final skill I want to talk about, is a little bit complicated. It's called CAPD. Now, CAPD is something I've never learned in school, but it stands for Continuous Abdominal Peritoneal Dialysis. Let's think about what that means. So the peritoneum and the abdomen are basically the same thing. Think about the inside of your abdomen. You have all these organs. Around these organs, there's got to be a lot of blood vessels. That way you could take nutrients from your digestive tract. So just think about right now, don't worry about the organs, only think about all the capillary networks that are in your abdomen. It's a perfect place for the exchange of waste, filtrate, and fluid. But what's the usual organ that wastes get excreted from? If you say kidney, ding ding ding, you're correct. Your kidneys function as the filtration system. That's where all your waste goes from your bloodstream into your urine. However, how do you get rid of the waste in somebody whose kidneys aren't working with renal disease? Well, you gotta use the peritoneum instead. If you have kidney disease and you get this buildup of waste in your bloodstream, you're gonna kill yourself. So you gotta get rid of that waste somehow. What's a good way to do it? Well, there's normal dialysis, where they hook you up to a machine, attach it to your bloodstream directly, and they filter out the bad blood with the good blood. Another option, which is less invasive, is called the CAPD, continuous abdominal peritoneal dialysis. Let's go back to the capillary network in your abdomen. Basically, what you're doing is you're administering fluid into your abdominal cavity. That way, the fluid can interact with the leaky capillaries in your abdomen and pull out the waste from your blood in those capillaries and exchange it for some better nutrients. So these people on CAPD, they insert a bunch of fluid via a tube into their abdomen. It sits there, exchanges with the waste from your bloodstream, and then when the waste is in the fluid that you originally administered, that waste fluid can be taken out via another bag and tubing system that's on the floor and can be drained via gravity. That way, when that old fluid gets taken out and is drained, you can put new fluid in to do more waste excretion. If you don't have a background in like science or biology or nursing or medicine or whatever, you're gonna have to look this up because I'm not gonna try to explain this all day, but that's the basic premise of how this works. Waste excretion via leaky capillaries in your abdomen with using fluid as the diluent for the waste that comes out of the body. Get it? Got it? Good. Okay, that's all I want to talk about for skills for now because my mind is already blown with all the stuff I've already said. I didn't know I could explain it like that before, so let's just get right into what happened next. I got out early and I went home. When I got home, I stuffed myself with some more food that mom made for lunch. It was really freaking good. I hopped on the PC, worked on some wholesale business stuff because I got an email from the supplier today asking for me to fill out a purchase order form, so that's what I gotta do next. Meanwhile, Henry and John are at the warehouse working, scanning through Gaylords, getting ready for the shipment that we're getting tomorrow. Now, I'm originally gonna meet Henry and John at the warehouse earlier, but I have this PC stuff to do. I want to set up this financial 403B plan for myself, so I continue working on that on the PC, and then I get really freaking tired, so I decided to take a 2-hour nap. I take the 2-hour nap, I eat again, and then it's time for me to go back to the warehouse to meet John and Henry. I find them picking eBay orders, which is nice. I get to work on picking Amazon orders. I train Henry on how to help me package books, and then we're pretty much on our way home. Now, Henry got hungry, so he decided to go to Burger King and pick up a chicken sandwich for himself. I was just gonna wait to go home and eat more. John was gonna do the same. So Henry offers to get us some stuff, but we decline. Once we get home, that's pretty much it for my night, because tomorrow we have to get up super early, 5:30 a.m. for the 7 a.m. delivery that's happening. 300 boxes of books coming tomorrow. Last time was 100 boxes, this is 300. And I'm gonna have Henry, John, and Dad helping me out take this delivery. I'm hoping to get it done soon tomorrow. That way we could go to work on scanning them, but we'll see how it goes. There's always problems that come up regardless. Till tomorrow then, peace out.